Welcome all of you here for this first opiate prevention workshop that we're hosting here at the Granger High School. This is done through a legislation bill with the help of Senator Honeyford and Bruce Chandler and Default. We worked on it for the last 3 years. With that, I'm going to say to you, welcome, and then I'm going to introduce Superintendent Brian Hart.
Thanks, Gilbert. I'm Brian Hart, Superintendent of Granger School District. I'd like to welcome all of you to this great event. We are in a partnership with NCEC and NCEC School District. It's called a Stop School Violence Partnership. And one of the goals is parent communication and parent outreach and training. We hope that this opioid training will be beneficial for you. We want to do everything we can to partner with our families and our students to make our schools a safer place. Thank you for being a part of this today. I'm going to go ahead and introduce Dr. Esperanza.
Hello and welcome to the conference. I'm Esperanza Lemos. I'm the coordinator for the Stop School Violence Grant, part of the Bureau of Justice Assistance. Our goal, as Dr. Brian Hart talked about, is to reduce violence incidents and increase youth mental health help. Right now I want to introduce to you Mr. Martin Yanes, Program Manager for Opioid Prevention Program.
Thank you very much. Today we're very fortunate to have some very two professionally trained people, Dr. Ileana Ponce and Dr. Michael Parchman. Both are representative of the community health workers, migrants, and refugees. We are here to promote the training program for the community in regards to the opiate epidemic. And we would like to, before we start, we would like to have Rebecca Barrio do some instructions on the evaluation. Thank you very much. Before Dr. Forte and Dr. Forte come.
So we're going to go ahead and pass out a survey for you guys to do. We want to know what you guys know before we do this presentation, and then at the end we're also going to do something for you guys so we can see what you guys learned, and more importantly so that we can learn for ourselves on what we need to improve throughout the workshops. So we'll go ahead and pass those out right now, and then Dr. Ponce and Parchman will start their presentation. Thank you.
I would like to say that this workshop is going to be reproduced and shown through our KDNA Opioid website and also through the social media avenue. Dr. Ileana Ponce and Dr. Parchman would like to conduct this workshop to the very best of their ability. They have extensive years of doing this kind of work. I believe 5 years for a coalition. And at this moment, without any more to say, I would like to welcome both of them.
Hi, thank you, Martin. I wanted to thank you to Radio Cadena, CIMAR, and Granger High School and the Prevention Society for inviting us to speak today about an important topic that is opioid crisis, because it's one of the big public health challenges, not only in the nation, but it's more important here in the rural area. I am a physician by training, originally from Nicaragua. I also a director of the Community Health Working Coalition for Migrant and Refugee, and I assistant professor from University of Washington. It is also my pleasure to introduce Dr. Michael Parchman.
Hi everybody, it's wonderful to be here today. Thank you so much for inviting us to your high school to come talk to you about this important topic. My name is Dr. Michael Parchman. I'm a family physician. I'm actually employed by Kaiser Permanente, but today I'm here representing the Community Health Care Coalition for Migrants and Refugees. I am the chair of the board of directors for that organization, but we're here today to talk to you about opioids. I've been spending much of my career, the last at least 5 or 10 years, working on this topic, and we're going to share with you some of our understanding and some of what we know and some of the evidence behind preventing opioid overdose and evidence around how we can tackle the opioid epidemic in our local community. So we're very pleased to be here today. Thank you very much.
Yes, and now we are going to start with the workshop. We are going to do in English. For everybody, I'm going to say what is opioid. Any volunteer about what is opioid? Yes.
Opioides es un grupo específico de fármacos, el cual está siendo distribuido entre africanos, afroamericanos e hispanos. Lo usan para controlar el dolor intenso, el cual lo están usando ya niños solo para hacer sobredosis. Pasó esta línea entre un tratamiento a sobredosis.
Muy bien. Yes, she said in Spanish, and I'm going to translate, but she said opioid is something that is using among Latinos, Afro-Americanos, and Anglo, mean everyone, and it's using to treat the pain. And it's a drug that shouldn't be good, but now the children and youth are using and are giving dependence. Well, that is a good thing, and I want to add that the opioid is not only a drug to the pain, and I don't want you to believe the opioid is a bad drug. When they use it right, it's good, but the problem is the misuse, and this is why I'm going to invite Dr. Parchman to tell us a little more about opioid.
So that's a great question. Let me tell you a story. I'm from Texas originally, and if you're of the male gender and you grew up in Texas, you have to play high school football. So I played high school football, and in the spring during the junior varsity game, I took the handoff of the ball from the quarterback, ran around the right end, was tackled, and broke my arm. They actually had to carry me off the field. I wasn't able to walk because of the nature of the injury. We got to the emergency room, and I can tell you that I was extremely thankful for opioids at that point when I got to that emergency room because of the acute nature of the acute injury and the trauma that I had. So opioids are not bad when used in the right setting and for the right condition. I prescribe opioids. I am a family physician, and I prescribe opioids. There are patients for whom opioids are appropriate. We're not saying that opioids should never be used in medical settings, but they need to be used appropriately and for the right people in the right situations and the right conditions. When we got into trouble, and I'll just tell you this story from my perspective, is when the people who make a lot of the medicines that have opioids in them convinced us about 10 or 15 years ago that we were under-treating patients with chronic pain and that we needed to be prescribing more opioids. The story goes that they even published in a medical journal some articles about how safe they are. Turns out those articles were fake. They falsified the information in those articles. But because they were printed in journals that we respected, medical journals, a lot of us physicians, me included, said, maybe we are undertreating pain. Maybe we need to be prescribing more opioids. And so we made the mistake of prescribing too many opioids. Today, even as I'm speaking, the volume of opioids that are being prescribed, that are going out of the doors of our local pharmacies in our communities, is 3 times the volume that it was just 10 years ago. But we are still awash in opioids in our community, prescription opioids. And this becomes an avenue for a lot of people, once they use opioids, to become dependent on them. And some people are more predisposed to become dependent on them. And that's why we're trying to address opioid overprescribing here in the state of Washington, specifically through a number of initiatives that I'm working on with support from the state of Washington and some other programs as well. That's why we're here, one of the reasons why we're here talking to you today. But we want this to be very interactive. We want you to ask us questions as we go through this presentation. What are opioids? You want to know what opioids are? Where do they come from? So it's in the name. It's in the name. There is a compound called opium. And historically, opium, and even today, you can derive opium from the poppy flower. So if you have poppies growing in your yard, guess what? You're growing opium. Even today. And it's been used by humans like you and me for thousands of years. The derivative of the poppy flower. But when it's turned into, when it's processed chemically, it can be turned into chemicals that are much stronger than what you get out of the poppy flower. And so there are 2 forms of opioids. There are naturally occurring opioids, which are processed from the poppy flower. And then there are synthetic opioids, because we as humans are really smart. We've figured out how to arrange molecules in what was originally the opium to make chemicals that are much more powerful than what you can find in nature. Right? And so that's where some of the medicines we use today come from. The oxycodone, the hydrocodone, some of those names may be familiar, are included in pills for pain now. And those are ones that we synthetically made or created in order to make the medicines more potent, more powerful. And unfortunately, that means they're also a higher potential for people to become dependent on them. So the risk of dependence on those medications is greater as well over time. So that's where the opioid medications come from. Did I lose the clicker?
Thank you, Dr. Parchman. And here you can see there are some examples of opioid drugs. And the most common is oxycodone, hydroxycodone, fentanyl. And the more common illegal are the opioids like heroin. And why it's important that we know what opioids are synthetic or not synthetic? Because the grade of dependence depends on the kind the opioid. And the word are the synthetic. And they are illegal. And they are drugs. But when we're talking about the opioid crisis, like Dr. Parchman said, we are talking about opioid prescribed for medical field. And again, what the message I wanted to give it to you as a parent, as a community member, is not memorize what is the opioid, because every day will be a new opioid. And every opioid will get the name or commercial name. What is important is when you go to the doctor and the doctor prescribes a tablet for the pain, you ask the question. And the question is this an opioid? And if he says yes, what you have to say is the only alternative that I have now, because there are palliative medication, but they are not as fast as the opioid. The opioid is delicious because when you have a severe pain you take, and it's so good. I experienced that myself when I have a hysterectomy. But you have a chronic pain because you work in the farm, because you are a migrant, you don't need opioid. You need therapy, physical. You can go, you can have a compression, you can use an ice package, you can use an hot water, water therapy, acupuncture. And I wanted Dr. Parchman to tell him about your experience in the clinic about manage chronic pain in primary care setting.
Let me add one more thing to what Dr. Ponce said, which is if you have a bottle of medicine in your house, your medicine cabinet, and you don't know if it's an opioid medication, take it to any pharmacy and go up to the pharmacy window and ask them if this is an opioid medication. And one of the things you're going to hear from us later in this presentation, and I'm going to say it now because I don't think it can be repeated often enough, is that if you have medicines in your house, in your medicine cabinet, on your bathroom sink, that are opioid medications, please dispose of them safely. You can take them to the pharmacy, you can take them to the fire department, even some doctor's offices now have safe disposal bins for you to put them in. Don't flush them down the toilet, because then they end up in the water supply. They end up going out into our beautiful Puget Sound, and we're starting to detect levels of opioids in the fish we catch these days, because it's ending up in our water supply. So don't do that, but dispose of them safely if you can. Okay, enough for types of opioids. How do they work? Let me tell you a little bit about why are we talking about this? What is the big deal? Why is this such a big concern? It's because of the way these medicines work in our brain. Okay? Because they have two effects on us. Yes, they relieve pain. They go to our brain and they attach themselves to receptors on the cells of our brain that tell us we're in pain, and they tell those cells to be quiet, so we don't perceive as much pain. There's another problem though, because these cells also, these drugs also attach themselves to the cells that remind our bodies to breathe. So I want you to do an exercise with me. All right, everybody take a deep breath and hold your breath, and we're going to hold our breath for as long as you can hold it, okay? You ready? 1, 2, 3. Turning blue. You feel that? You feel that? You feel that drive? That, oh my gosh, take a breath, take a breath, take a breath. Right? Your body does that automatically. How many of you sit there and remind yourself to breathe every 20 seconds? It's automatic. We don't have to think about it. Right? Well, the opioids attach to cells in your brain that prevent them from telling your body to breathe. So, your body forgets to breathe. So someone who takes too many opioids stops breathing. What happens when you stop breathing? You die. That's an opioid overdose. It's when you stop breathing. And that why these medicines are so dangerous, because, and the problem is that the pain response, your body adjusts to that pain response. So you have to get higher and higher doses of opioids to achieve the same level of pain relief, right? But your body doesn't adjust to the respiratory suppression, to the message to stop breathing. So those higher and higher doses just increase your dose exponentially, is what we call it. In other words, every increase in dose increases your risk of stopping breathing by 4 times instead of just 1 time, what it used to. So that's the real danger as far as opioids. They also can give you a euphoric effect, and that, as Ileana commented a minute ago, after her surgery, she was like, right? So you get that kind of euphoric effect from opioids as well, which is what also contributes to the problem with opioid dependence in the population. Do you want to add anything to that, Dr. Ponce? Anything else? No? Okay. All right, you want to talk about signs of opioid overdose?
Thank you. And you can see what is the importance, no? And every day in United States, unfortunately, is a person that died for opioid overdoses. And what is sad is that it's no people that wanted to be addicted to the drug. Most of them have been victims of the system to for the medical prescription of the drug, you know, and there are some very good examples, either between famous people, you know, about Michael Jackson. He had a burning and he started using opioid, and then the physician prescribed him opioid until you know how he finished. And also you have been seeing many TV program and news when you see the parent dead with a child in the back of the car. And this we can do something. You know, the opioid death can be prevented if everyone is trained. And this is why Radio Cadena, the Granger High School, the Prevention for Suicide is working in that. And this is why we are going to learn today here. And to start with the opioid treatment, we have to recognize how a person can be with opioid, what is the symptom, and because now you know what they cause in the brain, you can guess what is the symptom. Remember, they forget the brain to breathe, and you do the exercise, and how uncomfortable you feeling when you hold, you breathe, and you don't get oxygen. These are part of the symptoms. The person is going to start get blue, you talking with them, and they are not going to, in the first day, you know, they are going to look like disoriented, and maybe you're telling either the name, they are not going to respond to you. You can see the nails, there is no oxygen, you know, you are going to see them like purple color, they are going to look very pale, some of them, but be careful, because sometimes if this is a girl, she can have makeup, and she can have a pain also, you know, in the finger, and she can have a lipstick red, and you believe she is sleeping when she is. But the body is like losing, you know, extremely losing, and they can be vomiting, or if they are not vomiting, they can be like doing some kind of wave or noise, okay? And also, you can try to hear if they are breathing, or it's very slow, or maybe you say, oh, look like that. And this is the time when you have to start immediately to assist in this patient. The opioid is very addictive. First, because we are going to feel so good, no pain at all, but also stimulate us, make us to feel with energy, you know, make us to feel, to forget, you know, that thing that we are really created. But he tolerance. And for many of you that you don't know what is tolerance, it's mean that if one tablet help me to take the pain now, tomorrow to do the same effect, I need 2 tablets. And when you see, you are going to need 3 tablets. And this is why the people start with 1 tablet, maybe 3 times per day, or 1 tablet when you have a pain. And this is what is Angelo, because the doctors say, take a tablet every time you have a pain. Me, today I can take a tablet per day. Tomorrow I will need 2. And maybe in 1 week, I start with 1 and now I need 7. And this is when it's addiction. And this is why it's so important. But they are a side effect. You know, all the tablet, all tablet have a side effect. Next one. And then, you know, why this overdosing start? Sometimes because the pharmacy, they are human in the pharmacy. And sometimes the doctor prescribe, say 3 and they give him 30. Yeah, they can be 1, sometimes it's hours we're taking every time we need it. That shouldn't be done. We have consulted with the doctor. Sometimes the doctor say take 3 tablets for the pain. But maybe the 3 tablets you have to take every 8 hours. But I taking 3 tablets when I have the pain. And then 8 hours when the effect disappears, I going to take 3 tablets more. You see, sometimes that we don't understand really how to use the prescription. And listen this, it's very important. If you consume another drug or alcohol, they have an additive effect. What is the mean additive? Mean you are going to be more susceptible to get dependence because your brain is already burdened with that. And I want to invite Dr. Michael to talk more about that. You using alcohol, if you using opioid, you shouldn't use any other drug that will stimulate your brain. It's stimulate your brain.
So opioids become dangerous, as Dr. Ponce said, when the dose goes up, when they're used in conjunction with other substances that can have the same kind of suppressive effect on breathing, on your heart rate. But from a public health perspective, our real concern, and I know in most communities our real concern, is for our children, largely, and what's available to them through their friends on the street. Unfortunately, some of these substances that are being shared on the street are combinations of medications that we don't know. The person who has them doesn't know exactly what's in there. They could be a opioid medication that was taken from someone's medicine cabinet. It was ground up into a powder, and then to that was added another substance like fentanyl. And so you would think, oh, this is just hydrocodone or morphine or an opioid medication. But when fentanyl is added to it, fentanyl is a medicine that is 10 times stronger, at least, than most traditional opioids. And that's when the risk of the overdose goes up exponentially. It's when you don't know what's being shared or what's being taken by our kids on the street. And what we're trying to do is both educate our children, our families, about the danger of using anything that's offered to them that you don't know what the contents are, because it can make you stop breathing. We don't know. As well as making sure that the opioids that we do have in our households are not available, and getting them off the streets. And then talking to our physicians, our clinicians about prescribed opioids and decreasing the supply of opioids that's coming out of our pharmacies as well is another important public health initiative. And the state is doing a number of other initiatives around making treatment available those who are dependent on opioids, because those are the people for whom the risk of overdose is the greatest, and we'll talk about that in just a minute. I'll tell you a story that I heard from a colleague. So he had a very elderly gentleman that was very sick, had been very sick for a long time, was had home health care. He couldn't leave the home, and actually my colleague was occasionally making a home visit once a month or something to check on him. He had a number of chronic conditions, very complicated, but one of them was a condition called spinal stenosis. He had a lot of pain, and opioids were an indication for this. And he was actually sort of in hospice care. Those of you who know about hospice, and been in hospice care for quite some time. But the home health nurse that was the normal home health nurse changed, and a new home health nurse came in, and she had the medication orders and the list of medication the patient was taking, and she gave him the medicines as usual, and he stopped breathing and died. And it turned out that the opioids that were being prescribed to him, he was not taking, but he had a nephew who was coming in and taking them and selling them on the street. So he was not getting that dose of opioids that was on the medication list. So it was an unintentional overdose. And he died from an overdose of opioids that were administered to him. And everybody felt horrible. Everybody felt horrible about that situation. But it's just one example of what can happen from unintentional overdose use. So who's at risk? We've already talked about this a little bit. Those who are on opioids at higher doses, those who are using heroin, which is only available on the street. It's the only place you can get it. It's an illegal substance here in the United States. People who become dependent on opioids, we call it opioid use disorder. This is the term we're using in healthcare circles. It's called opioid use disorder, meaning that once you try to get off opioids, you just can't, because you start experiencing symptoms of withdrawal from the opioid, because you've been on them for a while and your body has developed a dependence on them. So you develop the symptoms of withdrawal, and they're horrible. The symptoms are really bad. It feels like you have a really bad case of the flu. You feel sweaty, your muscles ache, you feel like you're going to vomit. You feel very, very ill when you're going through withdrawal from opioids. Those are who's at risk of an overdose. And then just here are some of the numbers. It's very common because they're widely available. The opioids are in our community. So let me just stop there and just ask you, are there any questions? Ileana and I have been talking for quite some time about all this. Do you guys have any questions for us about anything we've said thus far? Any concerns? A lot of information, I know. Okay.
I have a question.
Sure.
I'm going to say, correct me if I got it right. Can we bring another medicine to the opioids at the same time or no?
So there are a lot of medicines that are very safe to take with opioids. So yes, so other medicines like high blood pressure medicine, medicine for diabetes, those medicines have no interaction with opioids. They don't make the opioids more dangerous to use if you're taking those other medicines. Yes, there are other medicines that are very safe with opioids that don't interact and have no side effects when you take them with the opioids. Is that your question? Yes? Okay. Okay. But there are some health conditions that make good increased risk for overdose. So if you have a condition called sleep apnea, where at night when you're asleep, you have trouble breathing. It's called sleep apnea. People with sleep apnea have an increased risk of overdose from opioids. Those kinds of health conditions. If you have some kinds of liver diseases, it makes you at increased risk for opioid overdose. So there are health conditions also that we need to be aware of that make it increased risk for overdose. So now we're going to get into the what can you do about it part of the presentation. So do you want to talk about the
They are strategies, and some are for people that work in the clinic, and some other are for people in the community. And I will advise everybody to know both of them, because both can save our life and the life of other person that have a son or a daughter or a husband that has opioid prescribed by a physician. This one that you are going to see here is the one that you can use for clinical stuff, you know. And the first one is we have to educate the medical professional about don't prescribe opioid. And actually the government is doing very good. All the National Institute of Health, this is a common effort, you know, for us to reduce the prescription of the drug among the clinics, and is to train the physician that opioid is not the first option for pain, especially as chronic pain. Opioid is safe actually you doing for very short period of the time after a surgery, etc. But really for chronic pain is only cause addiction. And for chronic pain we have other things, palliative like acupuncture, water therapy, exercise, physical therapy, okay? And this is why we have to remind the opioid. Why is my first choice? Everybody that go to the doctor and given that pill, you asking, is this an opioid? And then the person didn't answer, you can look in and Google it. And then asking, why opioid, why not other? The second strategy is see access to necessary treatment to people that have dependence. What is this? There are many people already, you know, that is dependent on opioids. And they are unfortunately some other drug that have the same effect of the opioid. Reduce the pain, cause all the euphoria, and it's a drug, but doesn't have the same action of the opioid that will lead to you to death. Mean they don't produce that the brain forget to breathe. And they are prescribed, and the Dr. Parchman is going to talk more about that because he is part of this group of physicians in the state that can prescribe that drug for people that already have this dependence. And it's safe and it's monitored for the doctor. And this is another thing. You have a son, a family that already is an opioid, they cannot live from them, they are an alternative that they can have another drug. I repeat this because it's very important. But this drug is not going to cause that they are going to die because they overdoses. The other thing is strategy number 5 is the naloxone. Who has heard about naloxone? Okay, the naloxone is the antidote. You know, like when you have a poison, you always have an antidote. You know, like if some snake bite you, that is an antidote. Then you have to think in like naloxone is an antidote for the opioid. And everybody shouldn't have one, like a ABC tool. You know, I have one in my car because if I see somebody outside, I can help them. And we are going to learn today how to administer it. There are different kinds of presentation, and the presentation that is nasal is very easy to use. We are going to talk that either it's a drug that you're keeping, if a police stop you and see that drug in your car, he's not going to put you in the jail. If you say you have that drug, to say like in the street, because they are a new law, and it's called the law of Good Samaritan. Either the person that you administrate the drug, that is with the drug, or the people that have the drug, that is the naloxone, none of them are going to be charged for the police for possession of drug. And this is in the state of Washington, okay? I am not sure if all the states have applied that, but you are safe if you have that drug. Most of the insurance is very expensive. Actually, it's between 150 and 200, the nasal, and it's two of them, you know, because when we learn how to administrate, you are going to see. But if you have insurance or Apple or any service, you can get it for $10 or $20. And also some institutions, you can get it for free. The one that prescribe and manage opioid. And this, the fourth strategy, always, you call 911, always, okay? Because when you are assisting the person, we are going to learn in the future that either if you administrate one, they can coming back. But if they don't coming back, you can administrate the second one, and they're coming back. And the naloxone is a very safe drug. Don't be aware or afraid that using that is going to cause any damage, because it's not. And we are going to talk more. And the last one is ensure that drugs prescribed use a state prescription monitoring program. And I wanted to invite one of the physicians that is part of this program in the state, that is Dr. Parchman.
So the last strategy is only if you're a prescriber. So anybody that I prescribe opioids to, when I refill their medicine or I give them a new prescription, I'm required to go online, look up that individual, and see if they have received a controlled substance, like an opioid, before from another pharmacy, from another provider. Because every pharmacy in the state is required to enter into that database any prescription they fill, any bottle or medicine they fill that they give to a patient that's a controlled substance, like an opioid. They have to enter that information into this prescription monitoring database that's maintained by the state of Washington. So it's just a way of us, as professionals, making sure that patients are safe. And that we're aware of what else they may be taking besides the opioid that we're prescribing. So I want to go over some practical strategies that you can use, though, to help with the opioid epidemic in your community. One is communicate with your physician about what you're taking in terms of medicines you're on. Only take medicines prescribed by your physician. Ask your doctor if the opioid is necessary. Dr. Ponce mentioned that earlier. Don't take more than is prescribed. Never mix it with other substances. But here's something you can do in your community, which is talk to your friends and talk to your family members about what you're learning about the effect of opioids, and ask them if they know of anyone who they're concerned about who may be using opioids, misusing them, or abusing them, and talk with them about what help is available for those individuals. So we'll talk just a minute about how to find help for patients who may be misusing or abusing opioids. We talked about disposing of medicines in your medicine cabinet, so we're trying to get rid of unused medicines that end up on the street. So please dispose of those medicines properly. And don't be afraid to talk to your physician or your pharmacist, your primary care provider, about any questions or concerns you have about the medicines you're on and whether they may be opioids, or about any concerns you may have about a family or friend who may be misusing or abusing opioids in your community. So those are just some of the things that you can do to avoid opioid overdose. So talk with your family members, talk with your children about this. Don't pretend like it's not a problem. It is a problem. If you open up and talk to it with your children, they'll feel more comfortable talking to you later about situations that they may be in. So it's okay to just put it on the table and say, It's okay for us to talk about this. In our family, we talk about these things. Make it safe. Make it safe to talk about. It's not judgmental. It's not, this, wagging the finger. It's saying, let's have a safe conversation about this in our family, with our friends, with our family, and let's make it an open conversation about this problem in our community. We know it exists. We're not going to pretend like it doesn't exist. There are situations where people, because no one goes out intentionally, no one wakes up in the morning, gets out of bed, eats breakfast, and says, my goal for today is to become addicted to opioids. That's what I want. That's my goal in life. No one starts off with that intention, okay? It's not like they planned for this to happen. Almost every time, it's unintentional. But it happens. We need to be able to talk about it and talk safely about it and say there's help available. There is some amazing help available now that wasn't available 5 years ago for people who are dependent on opioids. So don't be afraid to talk about it. Do you want to say something?
Thank you. Another thing that we have to be in mind that is very important is where your children get the opioid. And 53% study in the United States have demonstrated that 53% of average 12 years get the opioid from a friend. And we know this happening in our community, You go and say, I have a pain, and somebody giving you a tablet, and you drink. Sometimes, we believe more in our neighbor than in the physician. And this is why the opioid is very dangerous, because giving you a lot of, I will never say, I will be tired to say addiction. And then we have to talk with the children. As a parent, as a professor, as a student, I really thank you the efforts of the Granger High School, Radio Cadena in communication, because are taking the step that they need to do. Because if we don't talk with the children about the opioid or any other drug, other people will talk. And those maybe is not good intention. Maybe they wanted to talk about the drug to say, because I want to tell you one history, and this happened in one of my previous workshops in opioid. A mother said, you know what happened to me? I have a oxycodone because I have a surgery to remove my uterus. And then my son that was 13 years coming one day, and I didn't take the tablet, and my son coming and taking the tablet and say, Mama, you know that for each tablet or this prescription, I can get a $50. And the mother say, I was afraid, And I say, how do you know that? Because in the school, this is what they pay us to give him that drug. And that was here in Yakima. Do you see? This is happening, and it's happening in our community. And this is why we have to talk, and this is why any drug we have it now in the in our house, go and they can be disposed in many places. They are not going either to ask you for questions. You can go to the fire station. Either go to Radio Cadena and even then, they are not going to ask questions. The thing is to dispose in a good manner. The other thing I want you is to see that you have been exposed to this drug and you get it. You get another drug, you can have addictive effect, and also because they acting in your brain, incorrect doses can be very bad. And read pain when you have a prescription. Read very well the prescription. And for the children, parents, and all of you, the medical profession are taking care about the opioid crisis. But I believe they are a profession that is not taking care, and this is dentists. And dentists prescribe drug for pain. And guess what they like to prescribe? Oxycodone. Okay? Be very careful when you son go to the dentist procedure to see if they are prescribed opioid. Because they are not in the organization when they really has to report who prescribe opioid. Next one, please. These are 5 essentials, and these are for safe life. And do you want to do or? Okay, I wanted to say, this is the most important thing I wanted to do today with all of you. Because I wanted you, if you see somebody that needs help, you will be able to say that. And the first one sign is, you have to call the person. And you have, like, for example, I need a volunteer. You want to see the volunteer? Okay, we are going to invite Claire. She's a student from the University of Battle that she is today to assisting us. You wanted to sit down there and pretend that you are, yes, sleeping? Yes, pretend you are. Okay, if you see one person like that, that's about it. You come and you say, hi. She didn't respond. You are not going to say hi. It's hi. You have to respond like that. If she didn't respond, you have to think in that she is with the effect of opioid overdose, and you have to act faster. And if you have the Naxolone, you have to see that she reviews, that she doesn't have nothing in her mouth, so she's breathing and trying to giving, CPR, but you have the Naxolone, you have to apply. And this is you do it together, we call it 911. Yes, and then you have to do the assisting her. By the person, if the person, you call the 911, you apply the Naxolone as is in the picture, thank you. You apply the Naxolone as is in the picture, it's very easy. It's some little thing like a nasal spray, and you doing first close one with the nasal, and you apply and doing the other one. And if this person didn't reaction after 5 and 7 minutes, you apply the next one. And either if the person reacting after that, you have to wait in 30 minutes to stay with this person. Why? Because sometimes, usually the person that do that, they are addict, and it's not the first time, and then the brain can stop again in this period of the time. And never let the person alone, either until the 911 comes. And I know you have some more thing to say.
So I'd like everybody to take out their smartphone. Can you do that for me? Take out your smartphone and go to your browser, and I want you to look up a website. It's called stopoverdose.org. STOP overdose, OVERDOSE, stopoverdose.org. That's it. This is a website developed by the Department of Health in Washington State. They did such a fantastic job developing this website that it is now the most popular website on this subject in the United States. Every state is using this website. But if you go to that website and you go to this website and look about halfway down, it says naloxone, N-A-L-O-X-O-N, naloxone, the drug that reverses an opioid overdose. And it says find naloxone near you. You can actually enter your zip code and find where you can get the nasal spray we're talking about right now, in case you want to keep some with you, say in the glove box of your car, right? That is true. Thank you for correcting me. You can't keep it in your glove box because if it gets too hot in the summer, it deactivates the naloxone, right? So don't keep it in your glove box. Thank you. But if you are in the situations where you think you might run into someone with an overdose, so it's Saturday morning, you're going to the Walmart, you get to the Walmart, you didn't get there as early as you hoped to, because you had to change somebody's clothes 3 times before you could get them in the car to get to the Walmart. There's no parking available in the parking lot of the Walmart, so you drive around the side of the Walmart looking for parking. You end up going to the back of the Walmart where all the dumpsters are lined up, and you see someone lying on the ground behind the dumpster, not breathing. And there's a syringe lying on the ground next to them. What do? Well, you call 911. Step 1. What do you say when you call 911?
There's someone laying down not breathing.
Exactly. There's someone lying down and they have stopped breathing. Those are the magic words, right? They are not breathing. When the dispatcher on the other end hears the words not breathing or stop breathing, that's all they need to know. Because at that point, they're going to dispatch emergency response. Those are the magic words to dispatch emergency response. Right? Okay? Then you go up to the individual, you shake them on the shoulder, and you say, hello, 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 are you awake, are you awake, are you awake? And there's no response, right? If you happen to be someone who has some naloxone, because you found some naloxone, you know where to get it, you have it on you, then you can administer the nasal sprays, just like spraying any kind of spray up your nose you do yourself. Just one spray up one nostril and step back and see if they respond. Okay? The reason I say step back is because if you've ever administered naloxone to someone who's had an overdose, it is not a pleasant experience for the person you're recovering from an overdose. They don't like it. It doesn't feel good. And they're likely to get very angry and irritable at having this administered because it's reversing the effect of the opioid immediately. And so just take a couple of steps back and just see how they respond to that dose and wait a few minutes. Hopefully 911 will arrive very quickly, emergency response will. If it's been 3 to 5 minutes and they're not responding, you can administer a second dose. But it will save a life. Naloxone has saved literally thousands and thousands and thousands of lives of people across this country, if administered, as we just discussed. So, and there are a lot of other good resources at stopoverdose.org about what do you do if someone is dependent on opioids, what can you do for them? So, step 3, administer the naloxone. Okay, we got ahead of ourselves here. Next slide. If you're comfortable doing CPR, if you're comfortable doing respiratory assistance, you can do that. If you're not, you can wait on emergency response. Step back, watch the person's response. Sorry, I kind of got ahead of the slides here. Okay. Right? But stay with the person until emergency response gets there. Because they may respond immediately to the naloxone, but then the opioids take over again because the opioids are still in the bloodstream and they'll stop breathing. All right. And then community resources. A lot of them are on this stopoverdose.org resource page here. I'm going to talk a little bit about, do we have slides about medication-assisted therapy and opioid use disorder? Do you want to talk about these? Here we go. Right. So, there is now an amazing resource for people who become dependent dependent on opioids and they just can't get off. It's wonderful that people are able to taper off opioids and do it on their own, make it on their own, without any additional medications. But there's some people for whom they just can't do it. There's now a medication called buprenorphine, bup for short, that is called medication-assisted therapy. If you're a prescriber like me, you can go through what's called waiver training, and you become a waiver provider, which means that you're authorized to prescribe that medication, and you can give people a prescription. They can go to the pharmacy and get this medication. What is buprenorphine? Buprenorphine is like an opioid. One huge difference. It doesn't suppress your need to breathe. So there's risk of overdose is virtually zero. Buprenorphine. There have been now countless very well designed studies that have demonstrated that buprenorphine saves lives, where they have randomized people to either get buprenorphine or to go through counseling alone, and people who get buprenorphine are 4 to 10 times less likely to have an overdose than those who just receive counseling alone. I'm sorry, but that's just the research. Just what the studies say so far. I know it doesn't sound right. I know there are people who say, look, I got into trouble taking pills, I don't want another pill. But it is very hard for me, as someone who reads the research literature, to say, yeah, but there are some people for whom buprenorphine is a lifesaver. And medication-assisted therapy is increasingly available in many, many primary care clinic settings, such as federal qualified community health centers and other places where people like me have gone through the waiver training to be able to prescribe this medication. So there's help available for people who just can't stop using opioids. There's hope. And people feel like, people who do this, they tell you, I got my life back. I feel like I got my life back. I feel like I lost my life before to the opioids. And now I feel like I'm back to being a functional human being. I can hold down a job. I can have a family. I can have a family life with this help. So there are several resources available in the community for this. You can find physicians who are authorized to do that through the SAMHSA website, SAMHSA, buprenorphine medication-assisted treatment provider. I think it may be available on the stopoverdose.org. Let's start there, see if you can find who in your community is a waiver provider. If you know someone who might need some help with their opioid dependence, but there are resources available.
I wanted also to show the material that we are distributing in this workshop. And if you go to your folder, you are going to have many, many goods. And in this, we are going to have all created for CMAR and the Northwest Community Education Centers. You are going to have all the steps that we said, you know. And in this, you are going to say how to do our overdoses. And you can, if you need those material, please call Radio Cadena. Maybe we can facilitate some of them. And I invite everybody of you to learn more about what is opioid and be active in your community. It's the only way that we have been successful in controlling, but it's still a really sad history, and places like Giacomo and rural area are the places that there are not many resources, and we are suffering more of this. And thank you so much for giving us the opportunity to come here and speak about such an important public health concern.
So I want to thank CMAR, I want to thank the NCEC, National Northwest Center for Educational, what is it? NCEC and Radio KDNA. Northwest Community Education Center, thank you very much. I want to thank them, and I want to thank Radio KDNA for inviting us here today, and for Granger High School and for the superintendent, thank you for making it possible for us to be here today. It's been a real pleasure to be here with you. And Martine, do you want to say a few words?
I believe that we learned some really basic information regarding the opioid epidemic. What are some of the things that we can do? We know that it affects the mind, it affects the body, it affects the brain. Causes death. Today I learned some ways of how to help people, and we hope that throughout this year and next, we will be able to conduct more workshops and develop more materials that are easy to read and understand. And with that, I want to thank Dr. Parchman